If you've seen a Pringle box, you know the cover of a Pringle box, the thing that you have to pull open. So people think that, imagine taking a pen and just pushing it through the Pringle box, right? But that's not how people lose their virginity. Hi, I'm Deepti Pinto Rosario. I'm an OBGYN and I'm from Goa. You're watching me on GoaTalks. So I don't think I really chose to be a doctor. I think the profession chose me. I grew up in a home that was had a hospital in its backyard. The hospital was attached to the house. So I grew up watching my dad go in and out of deliveries. He used to take me on his arm to do rounds. So it was pretty much ingrained into my DNA. And I knew that I always wanted to do medicine, and I very specifically always wanted to do OBGYN. I just always knew. So when I was doing my MBBS, I did have second thoughts about maybe I should do pediatrics, might be a little bit easier, a little bit cuter, less blood. So I did add other subjects onto my list of potential careers. But then I went into internship, and I know the whole process of just seeing that baby crowning and coming out was so beautiful. It was like a flower blooming or something. It was just magical. And the baby coming out, the placenta being delivered, the joy on the mother's face, the whole process of breastfeeding, bonding, everything was just made so much sense. Like something in the universe just clicked. It was beautiful. I did my MBBS here in Goa Medical College, Bangoli. And then I went to Christian Medical College, Vellore, which is one of the leading medical colleges in Asia, where I completed both my diploma and my master's in OBGYN. I have the gold medal at Tamil Nadu University for my post-graduation, after which I went to Porto, Portugal, where I did a 6-month course in gynecological laparoscopy. I am currently a consultant and the co-director of Pinto Rosario Hospital in Porvorim. This is a hospital that was started by my grandfather back in 1938. In fact, we're Goa's oldest existing private hospital right now. And I run it with my husband, who's also an obstetrician gynaecologist. And of course, under the watchful eye of my dad, Dr. Deepti Pinto Rosario, who has run it by himself for the last 50 years. I didn't really have that experience of going to a doctor or falling sick and, needing to being scared or having to go somewhere to get better. My dad just took care of all of that. And my mom as well. She's a doctor as well. So that way, we were pretty set. Unless we got really, really, really sick, we didn't really see other doctors or hospitals very much. We also don't take illness too seriously, I think. We just go about our daily lives and not as scared about. I think that's quite a blessing that we have in our lives, because as doctors and having parents that were doctors, that fear around illness in hospitals is not there, as well as the drive to remain healthy remains. I think the only bad part is dinner table conversation is medicine, and it continues into my marriage because my husband is also a doctor. So a lot of times we have to remind ourselves that no, we're not at the hospital, we're at home. So change the conversation. PCOS is polycystic ovarian syndrome. It is a disease that we're seeing much more of these days, especially among young girls. And unfortunately, we don't know exactly what causes it. It's something that has a multifactorial origin, as we say. So it's a little bit of genetics, it's a little bit of what you ate when you were in puberty, how much of exercise you do now, how much of exercise you did when you were a child and going through those transitions, what your mom ate when you were in her tummy. So there are so many factors that give rise to PCOS, but it is definitely increasing these days than it was a couple of years ago. Now, PCOS has a couple of things that happen in somebody's body. One is ovulation doesn't happen regularly, so there's a lot of hormonal imbalances. People with PCOS might not get a regular period. They might have increase in the male hormone in their blood, so they may have features like annoying hair on the face, on the chin, on the hands more than usual, and they may have hair loss on the head because of increased testosterone level and male pattern balding. They may also have other features like diabetes and blood pressure. And no matter how much exercise and diet they do, they may not be able to lose weight as easily. Thyroid issues, cholesterol issues. So PCOS does take a lot of stuff out of you, and you really need to manage it well. Number one, if you have PCOS on scan on an ultrasound, that means you definitely have PCOS. But that's not the case. You need to meet 2 out of 3 criteria to have PCOS. One is irregular periods, one is increased levels of testosterone, and the third is PCOS on ultrasound. So you don't really need to have PCOS on ultrasound to have PCOS, and vice versa. Second, the PCOS, polycystic ovarian disease, they aren't really cysts as such. They're just little follicles that aren't doing their job very well. So the C for cysts, they're not actually cysts. Number 3, all PCOS sufferers are obese. That's not at all true. There are 20% of people who have PCOS who are absolutely lean. They're so thin, but they still have PCOS. Number 4, you can't get pregnant on PCOS. That's not true either. You can absolutely get pregnant on PCOS. I think period cramps, unfortunately, do happen to be part and parcel of life of most women. But there's a huge spectrum. There are people who have minor cramps, and people who have excruciating cramps where they can't work. If you have those, please get them checked out. But if your cramps are not too bad and you just want to manage them at home without medication, some of your options are taking a nice hot water bath, using a hot water bag. I think you should just give in to those period cravings and eat whatever you want, even if it's chocolate and salty food and whatever. Just whatever makes you feel better. Also, what helps is heating pads, because hot water bags, sometimes you might hurt yourself. So you get these heating pads now. And there are even companies these days who have these little TENS devices, trans electrical nerve stimulations, a little patch. You just put it on your tummy and you put it on, and it gives these little electrical impulses. That helps. What really helps is just going about your day. If it's not too bad, of course, if you have to rest, rest. But if you can, just go about your day, do your regular exercise. Not exercising on your period is a myth, and take one day as it comes. I think I've delivered thousands of babies. I mean, I stopped counting after the first 200 because when I used to work in Vellore, we had 1,400 deliveries a month. That was our turnover. So thousands, I think. We have seen lots of complications, sometimes where the baby's heartbeat just falls and you need to put in an instrument and get the baby out, or perform an emergency cesarean, or sometimes when the mother's blood pressure can suddenly shoot up and she can have seizures. These are all life-threatening complications, but we've studied all of these in detail, and we know how to handle them. When you're talking about a birth plan, you have to take in account that pregnancy and childbirth and having a vaginal birth is never a given. I always tell my patients, I really wanted a vaginal birth myself, but I didn't have one. I reached 8 centimeters, my daughter's heartbeat crashed, and I had to be rushed for a cesarean section. Not at all my birth plan, but life-saving for my daughter. So I think you should have a birth plan, but you should be open to the idea that things can change, and also realize that we have 2 lives here and everything's not always as simple as it looks. Very important to trust your doctor, because in that moment you need to have that trust that they have your best interests and your baby's best interests at heart. Vaginal birth can take anywhere from 3 hours to 24 hours. There is early labor, which can take a long time, even up to 18 to 24 hours. And then after 4 centimeters, it does progress faster, the rate of 1 to 1.5 centimeters per hour. So that's from 4 to 10. So, but to reach that 4 can take a long, long time. A cesarean would take, the surgery can take even 15 minutes. The whole process maybe an hour at the most. So it's a huge difference. I think the partners are very, very important in the whole pregnancy and childbirth process. It's not like the olden days where we keep the husband in the waiting room. Your job is just not to pace up and down a waiting room and wait for that announcement that the baby's out. So nowadays we see husbands coming in for every checkup. There are things like postpartum depression, diet, nutrition, exercise, mental health, all of these things where the husband and the entire family plays a giant role. We also love when the husband comes into the labor room because they're the ones that can usually keep their wives the calmest, and they're a very strong figure for the person in labor. And it's so important that they're there the whole way to see the baby born, to cut the cord, to just be part of this miracle that's so important for the entire family. I remember one patient who had a history of her uterus rupturing in the past. So, a uterine rupture is a very rare case where the uterus actually bursts and the baby is thrown out of the uterus, and you can lose mom and you can lose baby. So we had a woman come in who had this history, and she was pregnant again. So this was when I was back in my residency. We admitted her in the hospital a couple of months before birth because we knew that this was a possibility of happening again at any moment. And I remember the entire department was having lunch on the terrace when we got a call from the ward saying that this woman had just collapsed. And the entire team just flew down, put her on a trolley, put in an IV, rushed her into the operation theatre. Other people had rushed to operation theatre directly to scrub up. The anesthetist, the pediatrician, everybody had been informed. We got her on the OT table within 10 minutes. And when we opened, there was a big hole in the uterus, and the uterus was just to one side. And the baby was in her tummy among the intestines. But the baby was absolutely fine, which was a miracle. We took out the baby and the placenta. We stitched up her uterus. And she went home walking and she was fine. I met her a couple of months later in the OPD, and she never forgot any of our faces and was so grateful. That was a blessing to be part of. We're definitely talking more about menstruation, sex education, miscarriages, and things like that. But I think we have a long way to go. There are still so many beliefs that are rooted and kind of ingrained in many of us. And those barriers still need to be broken down. We have a long way to go. I think we need to start educating our kids better, for one, and involving boys and girls. If I still go to schools to give period talks, and the first thing they do is separate the boys from the girls, that makes absolutely no sense. If the boys are also involved, they should know what is happening. Everything should stop being so taboo. These are all just normal physiological processes, and everybody just needs to know about them, because at the end of the day, when a woman is on her period, it's her husband that has to kind of understand and be around and take care of her childbirth. It's not a woman's burden to be carried. So a common misconception is that people bleed the very first time they have intercourse. So there is something called the hymen, which people keep talking about, right? And they say that if you lose your hymen, you lose your virginity. So these things tend to be equated. But people tend to think of the hymen as like a drum. Or if you've seen a Pringle box, the cover of a Pringle box, the thing that you have to pull open. So people think that, imagine taking a pen and just pushing it through the Pringle box, right? Fine. That's not how people lose their virginity. A hymen is not like that. A hymen is more like a scrunchie where it just kind of is more elastic and it kind of opens up. So bleeding for the first time during intercourse is not a given, and it is a myth that needs to be dispelled. Also, you can lose your hymen doing things like riding a cycle or gymnastics. So that doesn't mean you're not a virgin. So I think those are two myths that need to be dispelled. So one thing I think that parents need to know is that puberty is happening at a very young age compared to when we had it. So in our generation, most of us went into puberty around 12 to 14 years of age. These days, especially in Goa, they've done studies and they've found that the age of puberty has dropped down to an average of 10, with girls going into puberty as early as 9. Now, this age of 10 and 9 is when they get their first period. So, you need to realize that before they get their period, even like a year or more before they get their period, they're starting to undergo changes already. They're starting to undergo surges of the sex hormones. They're starting to get hair in their underarms and pubic area. Breasts are starting to grow. So, all of these things can come before the first period. So, you can't wait until your kid gets their first period to really talk about puberty. You need to start having those conversations way before. And I think it should just be a part of normal life where you, right from the time that 3 or 4, you just have many small little conversations and kind of cover everything. Be open to their questions. Don't try to change the topic. Answer openly and honestly. Get them the materials that they need. I'm writing a book on puberty for kids that have not gotten into puberty yet. It will be out soon. And I think that's super important. I think I do get positive as well as negative feedback. People have asked me, how can you talk about masturbation and things like that? But it's just something that everybody is doing, and there's nothing wrong with it. It's a physiological thing. I don't know what is there to be ashamed of. Also, think of all of these kids that, have these urges and then are scared that they'll go blind, or are scared that they lose their virginity, or are scared that they're going to be infertile because of it. I mean, somebody needs to talk about it. Somebody needs to reassure them, because a lot of people come into the clinic with their parents, or they're not at liberty to ask what they want. They get their information from their friends or the internet, which may not be the best source. So I think it needs to be done. I get my ideas basically from my patients. So people just who talk to me and ask me questions. I have this thing where I just let people talk in my OPD. It runs a bit late, but I want them to feel that they can ask me whatever they want. And I don't want them to feel rushed. So I think I base most of my content off of that. So as you grow on Instagram, you do tend to get a lot of trolls. And that used to affect me before, but it doesn't anymore. Now I don't really care. So that's one negative aspect of Instagram, of course. There's always somebody judging you, always someone saying something negative or just to be hurtful, which is fine. That's their prerogative. A lot of positives have come out of it. I mean, my favorite thing is people who message me and, it's made some sort of impact in their lives. Oh, I never knew this. Thank you so much for telling me. Oh, that's what's been happening to me. And I didn't even know that this thing was ever existed. So, I mean, that itself is a huge plus. Of course, I got to do a TED talk. I got a couple of awards. Got to fly to Mumbai for those. So that's been great. All been a great experience. The onus is really on the medical professional to keep themselves updated. Even though we do require a certain number of what we call CME points to get our registrations renewed. So we have to attend a certain minimum number of conferences to get our medical registrations renewed. Of course, if you don't keep yourself updated with not only the technical aspects of your field, but what's really going on at a societal level, because it's menstruation, it's childbirth, it's pregnancy. You need to know how people are feeling about it, and what are the taboos and myths and misconceptions surrounding it. Otherwise, it'll be difficult to deal with it. As far as the fact that some people find certain gynecologists especially unapproachable or judgmental, I think it is a lot to do with the way we've been taught medically, because patient approach, counseling, mental health, all of these are not super high on the list. It's more of the actual disease and how to treat it. So I think medical education needs to introduce a little more of sensitivity training, how to break bad news. All of these things need to be addressed more strongly when we are still learning to be doctors. So the advice I would give you for your reproductive health is there is a list of tests that you should be doing every 2 years from the age of 30 to 40, and then once a year. Your pap smears, your mammograms, find out what those are and see your doctor regularly. Remember that we have modern medicine now, and there are a lot of diseases and even cancers that can be picked up early and treated early and even cured on time. So it's so important that you see your doctor regularly as per what is recommended. Also, it's important that you know your own body, you know your period, you know your cycle, because everyone's is just a little bit different. So if you know your own body and you feel that something is off, always just go get it checked out. Go to the doctor, and if they don't take you seriously or you're not comfortable, go to another doctor, get a second opinion. But make sure that you get your gut feeling thoroughly examined.